Thank you, Dr. Amit. At the outset, I'd like to thank Chairman AIOC 2023 for providing me this opportunity. I'm going to speak to you on the MIGS, the Indian perspective in POAG in angle closure. At the outset, this article, the important article and a very inspiring article based on this, which I'm basing this talk on, is from Dr. Vanita Patakre's article, editorial in the IGO. People who are going to start MIGS or want to start MIGS, they can go through that article. Quite a nice article, very inspiring for people starting MIGS. So MIGS is actually minimally invasive glaucoma surgery, and the idea is to give minimal trauma to the conjunctiva, as much as possible spare the sclera as well. Do a ab interno procedure so that it's a bleb independent procedure. Very reduced surgical time combined with cataract surgery, it is possible, and very rapid visual recovery. Less post-operative
Ganesh,
visits.
your slides are not moving.
Can the slides move?
Oh, slides are not moving.
Yeah, okay. And less post-operative, very high safety profile and cosmetically more acceptable. So what we have, if you have involved the conjunctiva, for example, some procedures which I'm going to talk about is which will involve the conjunctiva, also considered as MIGS, we can call them as MIGS plus. So MIGS, usually we address the trabecular meshwork, so you can stent it, you can dilate it, you can cut through it, you can strip it, you can wash it. If you put it in the suprachoroidal space, you have some devices for that. If you ablate the ciliary body, so you can call it cycloplasty photocoagulation. If you add, if you involve the conjunctiva, you could do, devices are available for that, known as the pressure flow and the Zen gel shunt. And if you want to do a bleb independent procedure, also addressing the Schlemm's canal, you can do a canaloplasty procedure. So we don't have alphabet soup, but we have a lot of spanners which can be thrown at glaucoma. These are all the devices which are there, right from the eye stent, the hydrus, the trabectome, and the KDB dual blade, and CyPass, and eye stent, and also the pressure flow. So the idea is to use the natural eye's natural pathway, outflow pathway for aqueous production and drainage, so as to have a which has been untapped surgically so far. It's more physiological than the conventional trabeculectomy which we are used to, or tube shunt devices. So indications include mild to moderate open angle glaucoma, primary or secondary. Patient on 2 or more glaucoma medication. The idea is to reduce the number of medications, and needs to be combined with cataract surgery many of the times. And if you have intolerance and or barriers for usage of anti-glaucoma medications like allergies and non-availability of medication, then you could opt for MIGS. So the main demerit is that the intraocular reduction is not comparable to conventional glaucoma surgery like trabeculectomy, but you have numerous advantages. The main ones are the complications associated with TRAB and GDD can be avoided. They are particularly suited to reduce medication and also avoid extensive incisional surgery and ability to follow it, offer it in early stage of the disease spectrum. And you also have better quality of life, early rehabilitation, spares the conjunctiva, so you have area for future surgery, bleb-dependent surgeries can be offered. Very cost-effective alternatives are now available in India compared to ones which are available outside. MIGS have entered in India a little late, so the number of procedure and type of device available in India are limited, but you have alternatives to them. For example, if you have take the Omni device, you have the GAT procedure. If you use the KTB dual blade, you have the bang procedure. If you have trabectome, you can use an endoscopic cyclophotocoagulation or micropulse, which is, of course, in this situation, this particular device cost is an issue. Endoscopic cyclophotocoagulation was the original MIGS, which was developed in 1990, and can be used in a variety of glaucomas, irrespective of angle status, and sometimes more useful in angle closure glaucoma, because it updates the ciliary processes, deepens the chamber, and causes, it can be combined with cataract surgery also. And micropulse diode may also be useful in a similar fashion, which people are now exploring. Eye stent has come recently into India, which is by the Glaucos Corporation. And in India, the main issue is availability of specialized healthcare. And many patients present to us very late in the course of the disease. So that's one big limitation when we want to practice mixed procedure. And we have almost an equal number of incidents of angle closure compared to open angle. So all the MIGS are not applicable for angle closure disease. Cost is an issue. Skill set has to be enhanced, especially intraoperative gonioscopy. And you have to upgrade your equipment also. You should have a nice tiltable microscope, Maybe your OT table has to be changed too. And supplies and easy availability of devices should also be there. So the role of MIGS, you have better outcomes with increased safety and early rehabilitation. It is open procedures like TRAV will continue to be performed, and glaucoma surgeons will need to upscale the current practices and management of the disease. So some articles which have been published, so this is from the LV Prasad group by Rashmi Krishnamurthy. They have done KDB and they found that the number of medications and has been reduced significantly, as well as the intraocular pressure has reduced in about a short-term study actually. And two studies from Coimbatore, one from our center, one from the Eye Foundation. They have also found that intraocular pressure reduces significantly at the end of 1 year. This is from our center. We had a series of patients. We showed that even sometimes in advanced glaucoma also, we have a 12-month data. Some of the patients who present with advanced glaucoma, but not so much medicated, they also have a very good intraocular pressure control. And endocycloplasty versus phacotrap by Dr. Vanita Pathakre, they have significantly showed that the number of intraocular pressure, the number of anti-glaucoma medications is reduced, and the intraocular pressure in the phaco with ECPL is actually quite comparable to the phaco-trap group, with the advantage of not having the complications of the phaco-trap group. And coming to micropulse, the article from Dr. Sharmila from Arvind Madurai has shown you have almost 42% intraocular pressure reduction in primary cyclo micropulse compared to 37% intraocular pressure reduction in patients who have undergone a previous procedure. So I'll stop here. Thank you for a patient listening.